urgency to try to shift this underlying issue before, instead of just dealing with the downstream effects of these different diagnoses, which might be OCD, which might be tics, which might be hyperactivities, or something that has shifted the microbiome to be more inflammatory, to create an imbalance in the way that the immune system responds.
For a lot of these kids, they are missing keystone species at the beginning. Sometimes your instruction manual is just missing pages, and the ability to put those pages back in so you can kind of read the entire story is really key. In the pediatric population, it's creating the instructions for the immune system. It's triggering and kind of pushing along neurodevelopment. It's creating the integrity of the gut lining, but as well as the integrity of the blood-brain barrier.
When we look at these different profiles, as you mentioned, the microbiome and their GI symptoms and their neurological symptoms, like they all have a common thread.
Hi, everybody. Welcome to another riveting episode of Biome Breakthroughs. In this episode, we're going to explore the emerging role of fecal microbiota transplantation, or FMT, in pediatrics. From IBD to autism to PANDAS, we're going to unpack what the science says, where it's being used, and what we know about the safety of FMT in pediatrics. For anyone that's not aware, working in a pediatric population is a little bit more complicated, and both from a clinical standpoint, but as well as a trial standpoint, the bar to use a new drug in pediatrics is a lot higher, and the need for safety is greater. And so I think when we think about pediatrics, I think one of the keys is really understanding why pediatrics is different from a gut microbiome standpoint. And one of the biggest, and I think really interesting things about the gut microbiome in the pediatric population is, while it's still developing, it's probably one of the systems that becomes adult-like probably the earliest. So somewhere between 3 and 5 years, we would consider the gut microbiome to be what it's going to look like in adulthood. And we know that the gut microbiome is flexible and always changing, but there's some key species or some key factors that are going to stay pretty consistent. While all of this is true, the pediatric gut microbiome probably is the most flexible still in its adult state. So while the brain and the immune system are all still kind of coming online and becoming adult-like, the gut microbiome is reaching that first. And early insults like antibiotics, having a C-section birth, formula versus breastfeeding, ultra-processed diets, all of these things really early start to shape what the long-term gut microbiome, but as well gut-brain connection and immune pre-program is going to look like. And so I think this may have been why both in some areas we're seeing more use of things like FMT or manipulating the gut microbiome, and in some cases why people are a little bit more hesitant. And so I think it's really kind of formation as well as its flexibility causes both some logical or positive impacts as well as some hesitation from people as well.
I just want to highlight, if you're a clinician, you're sitting here listening to this, you've seen these cases where that early intervention, like the early treatments and what happens in those first few years of life has such a significant impact. And the way that I've often communicated this to patients is like, imagine having a garden and it's recently planted and the lettuce or whatever is just sprouting up and your dog goes and runs over it. Well, it could totally destroy the garden versus if the garden's like fully there, the lettuce and all the plants are really ingrained, it could be slightly damaged, but it'll come back. And so I've seen this clinically time and time again. I've spoken with thousands of families of that have had children with autism, ADHD, PANDAS, all the topics we're going to discuss today. I've treated hundreds of them. And of those, I could really say without having all of the data here, but of those thousands of people that I spoke with, less than 10 didn't have early use of antibiotics. So early use of antibiotics, I think, is on a vulnerable, still developing system can create such an impact, such a change on the signature of the microbiome that then is the foundation for the rest of our lives. And so I think it's such a critical window. And we need to be very judicious about the use of anything that could insult that developing fragile microbiome.
And we know that the microbiome influences so many different systems, but in the pediatric population, it's creating the instructions for the immune system. It's triggering and kind of pushing along neurodevelopment. It's creating the integrity of the gut lining, but as well as the integrity of the blood-brain barrier, because they're very interconnected, as well as, I think, kind of creating the baseline, maybe, I don't know if that's the right word here, but for how inflammation is going to be regulated. And so all of these are things, when we talk about all of these age-based diseases, adult diseases or neurodegenerative diseases, these are all the systems we're talking about that at some point stopped working. And so when we look at pediatric diseases, and so those are the ones we'll focus on today, but as well, I think as we start really teasing back where disease starts from a proactive standpoint, I think these early instructions being a little bit altered, and so the immune system doesn't kind of develop the way it's supposed to, or neurodevelopment doesn't quite line up the way it's supposed to, I think those things have long-term impacts. And from neurological, like neurodevelopmental diseases, well, there's a tie between the gut developing and the brain developing. And I think maybe on a long-term scale, maybe there's a tie back to that in some of these age-related diseases as well.
Right. Yeah. And I think that proactive angle, right? Because in many cases, and this is in part what you highlighted earlier, is that because it's so hard to do clinical trials in the pediatric younger population, like most studies are going to start at they'll start at 18 as like the lowest for any of these diseases. And then once it's gone through several phases of clinical trials, they may introduce like a pediatric one. The trouble then is just that there's not a lot of treatment options, right? When you're talking about autism, when you're talking about PANDAS, there are no approved drugs broadly. We're using other therapies. And in most of those cases, it's purely derived around symptom management or a reactive approach. And you might be using an anti-inflammatory, or you might be using an antibiotic to try to modulate the microbiome. The trouble is there's a layer beneath that. Like, what's driving this neuroinflammation? What's driving this imbalance in the microbiome? What's driving all of these GI symptoms? Like, sure, there may be an active pathogen, streptococcus, in the context of PANDAS, but once that's dealt with, and that's no longer the issue, now what is the underlying? What is driving this issue where a bacteria, streptococcus, is coming into the system, but now we're having a strong autoimmune type reaction? Like, as you pointed out, the development of the immune system must have been skewed such that we've attacked something that we shouldn't be attacking.
And I think it's interesting to see the areas where research is being done. And I find it's, again, in two camps. So you have pediatric IBD, especially we actually see an even balance between ulcerative colitis and Crohn's in the pediatric population, as well as treating with C. diff, which is where we're seeing most of the research in adults. And I'm finding pediatrics are coming in after, but because the knowledge base is so large there, I think the buy-in was a little bit easier. But when you're looking at what we consider pediatric diseases, so the disease starts in childhood. So we're looking like things like ASD, ADHD, PANDAS. The research, I think, is really pushed forward by parents or researchers that are really already very involved in that space, who are willing, I think, to go through those hurdles. And the size of the studies is always smaller because getting approval for 10 kids is like getting approval for 1,000 adults. And the ratios are, it's really hard to understand unless you've ever tried to do something like this. But we don't want to do anything to kids that will then alter their whole entire life. And I find it funny in some of these cases where we know that the gut microbiome has been destroyed or is not functioning properly. It's very easy. They can compare it to a neurotypical kid, to a kid with one of these conditions, and say they are definitely not the same. And we know that if this is not going to be fixed early on, for the rest of their life, it's going to cause issues. But we can't, the fear of doing something that will impact negatively into adulthood puts too much a barrier, I guess, to even trying. And so it's interesting in the cases where people are saying they're 100%, we can confirm that if you have this condition or if you've been exposed to this, your gut looks completely different than what we would consider a typical healthy child. And that's kind of where we're seeing this jump off, is that we know they're different. And we know that if we could make them similar, then all of the systems that are lagging behind because they're not reaching that are going to catch up. And so I think for me, all of the changes and the wonderful improvements we see in these kids is great. But what's really interesting to me is how quickly within a treatment window, they get to close to or at the same level as their as a typical healthy kid in terms of what their gut looks like, but as well as what their immune system and brain development, all these things catch up, the earlier you fix the initial problem. And a lot
and I think that we know this, and this has been studied and looked at for all types of treatments, and early intervention is like so critical. And I think the reason why it's so critical, because as the brain becomes more formed and all the pruning and all the stuff that happens there, as the gut microbiome becomes more formed and stays in the state that it's going to be as a sort of adult-like microbiome, it becomes harder to shift that into one that can reprogram the immune system, that can reprogram our response and reaction to some of these things. So what I've seen, and often again, while having these conversations with families and parents, is the earlier you can intervene to shift this foundational gut microbiome dysbiosis profile, the better likelihood you're going to have a long-term effect on the brain. You can have an adult with constipation or with diarrhea, and FMT is going to be a fix. But when you have the neurological component, where it's the brain is still forming, it's very elastic when you're younger compared to when you're older. It's more fixed. It's harder to make those shifts. Now, you might still see a change in anxiety or depression or hyperactivity or some of the OCD behaviors and things. But from a developing speech and some of those roadmap things that would have been triggered earlier, in many cases, that boat unfortunately has sailed. And so that's where the urgency to try to shift this underlying issue before, instead of just dealing with the downstream effects of these different diagnoses, which might be OCD, which might be tics, which might be hyperactivity. So that's really peeling the onion back and trying to identify what's connecting all of these, right? Even the disease states that you mentioned, right? IBD, ASD, PANS, PANDAS, all of them show a signature of gut biome dysregulation. Something is off, especially when you're comparing it to the neurotypical peers. And so that's a pretty obvious indicator, a connection among all of them, that if we can shift that early on, we may well see long-term changes in some of these other symptoms.
Yeah. So I think from a safety standpoint, we know from treating pediatrics with C. difficile infections that similar to adults, we're seeing a very similar safety profile. So very few serious adverse events. Those go down significantly when you're doing proper donor screening and manufacturing is done in a proper environment. So we're seeing that the safety profile is very similar. So those same kind of nuisance side effects. In some of the inflammatory bowel disease studies, we are seeing one thing we don't normally see for adults. It's normally changes in bowel movements. But from a standpoint in kids, there tends to be in this population comes up some mild constipation. That seems to be like the bowel change, but all of the other ones seem to line up to be pretty consistent. And it's interesting because in the adult population, when we're looking at inflammatory bowel disease, ulcerative colitis has been the focus. That one seems to be most consistent. We're kind of doubling down on that one. Crohn's seems to be a little bit more all over the place. Some studies show great success, some show no success. And so I think that we're still kind of sussing out, understanding what the difference between Crohn's and ulcerative colitis is in terms of where the gut's playing a role there, as well as trying to better understand. We've shifted our understanding for ulcerative colitis. You got to treat for longer. It's got to be more intensive and it's got to be more consistent. And so maybe we're not quite there yet with Crohn's. In the pediatric population, studies, there are less studies, but the studies in Crohn's look really promising. And so I don't know if what Crohn's disease looks like when you first get diagnosed with Crohn's disease is very different than what happens years after having Crohn's. I think that's something that I think is important to note when we're looking at how we're seeing improvements and how long lasting those changes are, is treating earlier. Again, we may say this 100 times in this episode, but treating earlier, like the structural changes that happen because of these diseases are going to be much less severe when you're first getting diagnosed and first really getting into what that disease is versus in adulthood when you've been dealing with these flares and dealing with all of these long-term adverse events and all of these different kind of systematic changes that are happening from having this disease. Then treating later, does that have play a role? And I wonder if that's what we're seeing differently in Crohn's in pediatrics than we are in adults. But overall, the rates look similar or even better than we're seeing in adults. So looking 1 to 2 months later seems to be the average, up to 6 months. But we're looking at 65 to 60% changes into what we consider remission in these cases, which is quite high, especially when the alternative for treating these kids, I think, will also have some long-lasting issues. I think high-level steroids and things like that are being used in a lot of these conditions, because there isn't really a great what are we going to do here? I think those also have some negative impacts, not just outside of how they're treating and some of the side effects associated with them, but as well, I think they may kind of even further change the instruction manual for things like inflammation and the immune system as well.
Yes. Yeah, that's early intervention for the win. It's it's challenging because oftentimes the parent in this context, like, it's hard to even get initially a diagnosis. So there's so many roadblocks and delays along the way. And that's why we love working with the integrative functional, the doctors who are really charting the course on trying to help people with the early intervention, doing the appropriate lab work and assessments, and trying therapies depending where it's most needed or indicated. But FMT being an earlier intervention, like, don't wait until it's fully progressed. And I would see this all the time, right? Like, dealing with, some people would choose this as sort of like a Hail Mary. They wait until it's so progressed that it's hard to come back from, right? There's so much inflammation. There's so much immune dysregulation that it's hard to shift at that stage. And this is why the being proactive with our health and our healthcare and really owning it individually has such an impact on the long-term progression of the disease and illness. Yeah.
Yeah. And I find, for me, looking at this, I always find it interesting, but when I really do see this as like the beginning of the instructions on how to do everything else. And some of this comes, and we'll touch on this more when we touch on ASD in a second, but we know that one system becoming underdeveloped triggers other systems to not meet their milestones. And so the gut seems to be one of the ones, because it's developing earlier. And I think we need to reevaluate this whole concept of the gut being sterile before you're born, because I don't really think that's how it works, but try to keep our things that go against the grain to a minimum today. But but I think it's really key when we're looking at, and there's 2 or 3 studies that have looked at this specifically in inflammatory bowel disease, but in the Crohn's as well, but is looking at the redevelopment of key species that were not present in the gut. And so there are some that we consider, like, generally to have a healthy gut, you need to have these in existence in your gut, right? And they're really hard to replace, and that's where FMT comes in. But for a lot of these kids, they're missing keystone species at the beginning. But after doing FMT, not only are they there, but they're long lasting. And so I think that's part of it, is like, sometimes your instruction manual is just missing pages, and the ability to put those pages back in so you can kind of read the entire story is really key. So I think that's really interesting. And then not in all of the diseases we're going to talk about today, I think has been as well mapped. But I think that was one of the things that stood out to me when looking at this, was that someone looked and go, this is what we're measuring in adults to say if something is successful. So let's see, were they missing keystone species, and have these come back afterward? And I mean, we're still understanding that, but what those are. But we know that sometimes if you're completely missing a population, you're not magically going to get it back. You really, you need seeds to make something grow. And I think that for me was interesting. And I think that kind of follows through both for pediatrics and adults, is understanding what's missing, and then understanding the capability of, can we rebuild something if there's no groundwork to build back from? But yeah, that's my rant about gut and key species, I guess. And so now into, I think the other side of this is that, like, neurological or neurodevelopmental diseases are something that get diagnosed younger, and we know that there's a tie to the gut. And so with autism spectrum disorder, kids with ASD have 3 times more likely to have severe GI issues, but as well that are 3 times more likely for those GI issues they have to be more severe. And so they kind of get double hit with having the issues, and then when they have them, they are going to be worse. On top of that, we know that how having issues like GI issues is directly correlated with how severe behavior is. So we know that the gut is definitely driving some of the behaviors, or the severity of those behaviors. We also know there's reductions in neurotransmitters levels, which are some of the gut makes some of it completely almost, but also they send a lot of the building blocks to be able for the brain to make those. On top of that, we know that the gut is underdeveloped and we know that the brain is not reaching these key critical periods at the right time. And so all of this groundwork really lies where, okay, so is the gut playing a significant role in this neurodevelopmental disease? And I think from everything we know, the answer has to be yes. And I know it's hard sometimes to think of something we think so strongly as a brain thing to go, I think it starts in the gut. But more disorders that we think are brain seem to be gut. And I think this is one that's a really good thing where like all of the gut stuff seems to come first. And you're getting diagnosed at a time when in the 2 seems to be the earliest, 2, 3. That's the time when we're transitioning out of this really flexible gut into adult-like, and it's just not meeting that milestone for that transition. Your thoughts on that, Jason, having seen this outside of the books?
Yeah. I mean, it is complicated, and there's so many different moving factors, and I think there's so many potential triggers. We all want to like, science just wants to like boil it down to like one cause, one everything, but it's so complicated. And I think there are so many different triggers. But what we do know is that when we look at these different profiles, as you mentioned, the microbiome and their GI symptoms and their neurological symptoms, like they all have a common thread. And I mentioned that earlier, right? Even including IBD and PANDAS, which we can talk about. And I think we might even loop PANDAS into this same discussion because there is so much overlap between autism symptoms and the PANDAS symptoms. And it was very common, at least in my experience of treating a lot of these kids, is that it was unusual, although possible, but unusual that we would see only PANDAS. It was often autism combined with PANDAS. So what is it for practitioners who maybe aren't seeing a lot of this, haven't heard much about it, or may actually have patients in their practice who have this, but just haven't formally received a diagnosis. So we can talk a little bit about like, what is it, what's commonly being used to treat it currently, and why that may or may not be the complete solution. So basically what happens is this child, in this case, usually they're between like 3 and 12, will get a strep infection. And that's very common, right? It's very common to get a strep infection. But what happens is that, and again, this could be back to like the immune programming being off, but it develops ultimately like an autoimmune response. So instead of the immune system just going after where the infection might be, in this case, the throat, it actually starts going after the in the brain. So the immune system somehow is confused, starts producing antibodies. These cross-react with brain tissue, typically in the basal ganglia. And then almost what can seem like overnight, and this is like a real key indicator of this might be a PANDAS thing, is the child gets sick. And then overnight, they start to develop these really weird symptoms. Might be like OCD, might be tics, might be both. And so there's this really odd presentation. And it usually has more of like an acute phase, and then it could then slowly diminish over time as the immune system sort of calms down, and potentially as interventions are put into place. An antibiotic for the streptococcus could lower things. But because it's now an autoimmune disease, anytime there's a re-exposure to strep, it causes what is often termed as a flare. And these flares could, in minor cases, could be several days. In more severe cases, this could be weeks to months. And the treatment often, and I'm just hammering on this because we don't talk much about PANDAS in this context, but oftentimes the treatment would include antibiotics. It would often include some anti-inflammatory, prednisone being sort of a heavy hitter there. And then there's going to be some management of like the OCD, the anxiety, the behavioral, the tics and things, and that might be with SSRIs. This is more of a newer thing, although it is very expensive. It's very hard to get approved, but is modulating the immune system with IVIG. And so that's actually using like immunoglobulins given via IV and or plasmapheresis, which is basically like trying to remove these immune antibodies from the system. And so all said, it's very challenging. It goes through these cycles of like flares managed. And I'll talk a little bit later on just about my experience and what I've seen from a PANDAS approach. But as someone who may be experienced in the space would identify, there is a lot of overlap between the autism symptoms, which can also include tics, which can also include these things, but it doesn't, usually it won't be these flares, right? Like you'll get sick, you'll see a big flare, you'll get some exposure, you'll see see like a sharp peak in some of these symptoms. And so again, you can have autism without PANDAS, but oftentimes they do come together. And what connects them all is, again, I hate to sound like a broken record here, but is this microbiome imbalance. We can see that there's something going off. The signature of the microbiome in both cases is imbalanced. There's something that has shifted the microbiome to be more inflammatory, to create an imbalance in the way that the immune system responds. And so we have these drivers of this cyclical disease, and we need to figure out more downstream versus just managing with antimicrobials, immunomodulation. We need to be thinking about this more at a foundational level. And I think in many cases, modulating and shifting the microbiome is going to be the ultimate way to try to shift the way that the presentation of this disease works.
Yeah. And I think for PANDAS, and this is one of my new favorite things about gut microbiome research, is we just keep adding things. It used to be the gut brain involvement. And now for PANDAS, the way that they group it is gut immune brain involvement. And I think we've been talking about this for a lot, but like the immune system not forming correctly causes a lot of other issues. But the immune system is really important. So it makes sense that if that doesn't reach or doesn't get to the point that it's supposed to start becoming protective, that you're going to have all these secondary things. So to me, it makes sense in PANDAS that you're going to get neurological symptoms because the immune system and the gut barrier kind of integrity gets impacted, but also the blood-brain barrier integrity gets impacted. So now you're getting things going places that they're not supposed to go. And then the system that's supposed to handle that cannot handle that or does not have the right kind of gas brake pedal system going. A little bit too much gas, not enough brake. That turns on too much, but then that system doesn't know how to cool down. And then that causes other things. And I think you're right that there is a lot of overlap. And I think in terms of what we know what to do, fairly similar. I think it's taking from other areas. I think that looking into how we treat PANDAS, it's looking into other areas we know and trying to apply that here. And I think that consistent use of antibiotics isn't helping the gut not developing properly. Probably keep pushing it back further. And
quickly, this is what is so hard, right? If you're a parent or you're a physician working with this patient, like when there's a quick fix in just taking an antibiotic or going on prednisone, like it's almost impossible not to, because you see your child suffering so severely. But again, it like feeds into this cycle of worsening this whole thing. And this is like kind of going on a little bit of a tangent here, but this is why it's so critical to shift our mentality about the way that we think about disease and how we recover from some of these chronic illnesses. Like the body is very intelligent, but the programming is off. And the way that we need to think about solving this is like, we can't just kill our way to health. Like we eventually have to reorient and think, okay, what is the body asking for? What is foundationally wrong here? And what can I give? What supports can I give the system so that it can start to reprogram and act differently, behave a little differently, right? And so, of course, the diet is a huge factor here, but just the microbiome and how you feed it and what you do to it. And ultimately, again, replenishing, totally replacing it with a healthy microbiome. That is a way of fueling and building health up. So it's like ground up versus top down. And I think that's a critical shift that needs to happen. But again, when you're in this cycle and there's a lot of inflammation and you're dealing with all of these symptoms and behaviors, it's just easier to go top down. But if we really want to understand the causes, triggers, and how to ultimately shift and fix and repair and rebuild, that requires a very different mentality and approach and thought process. It is slower, but it can be the long-term solution, which can lead to complete remission of these symptoms and behaviors and ultimately the disease itself.
I think with PANDAS, there's definitely less research comparatively even to ASD. But the stuff that's out there, mostly case studies, I think at this point, case studies become really valuable because that's how we are answering most of the questions. Most of the discussions we have here started with someone getting treated with C. diff and some other condition getting better and someone going, we should look at that. that is the beauty of clinical science, where it's like, this person has this thing that came up, and C. diff is one of those things that there's part of me that thinks that the immune system is probably not working correctly, and maybe that's why you're more at risk to get it. But there's many layers to why people get C. diff. But in kids getting C. diff, similar to what we see in adults, they get treated with FMT for the C. diff, and then either their IBD gets better, or we see improvements in their PANDAS symptoms. And then it becomes, okay, so then how do we ask that question on a larger scale? How do we go, okay, so that improved. What if you took the C. diff away and just dealt with the condition? Do we still see those improvements? And so from a case study standpoint, we're seeing that, okay, so PANDAS patient gets C. diff resolves, that's confirmed, but then the gut microbiome improves, and we see improvements in those neurological symptoms associated with PANDAS. And I think that's the beginning part of further asking that question. And then when we look at that kind of connection between the similarities or the overlap between PANDAS and ASD, I think we can leverage a little bit because we know a little bit more. Again, early days, not as much research that we would like, and that is building, and there are current clinical trials happening. And I think that's the light at the end of the tunnel, where we're actively better asking these questions to get better information. But in kids with ASD, with treating with FMT, that we get significant improvements in their GI symptoms, and we get improvements in those ASD related behaviors. I think the goal here is, let's treat the gut microbiome and try to relieve some of these GI symptoms, because we know that's a logical connection, and we know there's a tie to the GI symptoms and the behavior. So that's really why I think that's the initial question is, can we help the GI symptoms using FMT? And then the bonus is that you get these improvements in ASD related behaviors. And so that's kind of been the way that this has been approached. And from a research standpoint, we see significant improvements in GI, significant improvements in ASD related behaviors. We see changes in severity scores for ASD, actually changing where on the sliding scale of severity that kind of you kind of shift down, as well as improvements in neurodevelopment. So like the gut becomes more developed, and therefore you start meeting more milestones. And this is really, for me, where we can talk about the most important part of treating early, helping, because if all these systems kind of catch up, but you've missed really important critical windows for brain development, the likelihood of getting those systems to reconnect and activate gets less and less the further you get from that critical window. And so things like we talk about, like speech, there are terrible old school studies, but like if we work in kittens, but like if kittens don't ever see all the different ways that you have vision, they'll just lose that part. So like horizontal or vertical, they just like lose the ability to see vertical lines because they just never were exposed. Similarly to speech, if you're not exposed to speech and you pass the window in which you can gain that, it gets really difficult to ever get it back, because the time in which the two parts of the brain that were going to be the most important to have that skill, they don't get the bridge to connect properly. And so while you can get some of these skills back, basically you make 6 bridges to connect 2 parts of the brain versus 1. And so signaling is slower. How your brain processes the information is different. And so you never really get to that same kind of concept. And so when we're talking about in kids and the need for kind of understanding what systems are dysregulated and how important it is that the quicker that we deal with those, the more likely we are that those systems can reconnect properly. But it's I think you've seen it more clinically. I see it from a book standpoint, of course, as always. But it's really interesting that we're trying to target GI. We get behavioral changes. And with that, the younger that someone is being treated, the more significant the outcome.
Right. And not surprisingly, we see first the GI improvements. The GI improvements are the first thing, the most obvious change in symptoms. And once the digestive system and the GI symptom improvements begin happening in the leaky gut, and we don't have all these inflammatory cytokines going out throughout the body and all the other things that happen with an improved gut lining, we then start to see the improvements in these other neurological behavioral things. And so that's pretty telling as well, right? You fix the gut it then has a downstream impact on the brain and other developmental things. And and I'll just comment too on I mentioned it earlier, talking just about my experience with the PANDAS. This is not as part of a case study report. So we didn't publish, but we've written up our data on autism with a fairly large group of kids that we treated, and really phenomenal stuff. We'd be happy to share that with anybody who wanted to reach out, and we can share that report. But in just anecdotally with PANDAS, it was very interesting to see the response. I mean, what was challenging, just thinking about this from talking with a doctor across the desk, is like, what's challenging is because these kids go into flares, it can be very hard in the course of like a 4-month treatment protocol to distinguish what's what, right? And this is always the challenge. Like, you're treating an ulcerative colitis patient and they go into a flare while doing some other therapy. Was it the FMT or the therapy, or was it just life happened and they got exposed to something, or had a really stressful period, or didn't sleep, or there's just so many variables. And with PANDAS, because there can be these steep flare points, it's very hard to delineate between, like, is this somehow related to the treatment, or is this just a natural course? This would have happened without treatment at all. So that is a sort of variable that does make it more challenging. But broadly, and I would say probably at least 10 to 15 kids that had pretty severe PANDAS, what I've observed is that in some cases, best case scenario, they just totally stopped having flares at all. It's hard to say, like, is this a permanent remission? Are they like cured? That's very hard to distinguish, because you could say like a year, 2 years later. I mean, we don't know. In theory, yes, I think it's possible. But in the majority of cases, the flares themselves the spacing between them would get much longer. So if they had a flare, it wasn't instead of every month or every 2 months or every 6 months. So the spacing between them was much longer. And then the severity of them was significantly decreased. So instead of going into like what could be weeks along of a flare, maybe a bad day or 2 days where they just have some reaction, but it's not nearly as severe, which indicates to me the immune system is totally chilled out. Like, there's still some immune dysregulation. There is still some autoimmunity, but I think the promising thing when we really reduce the severity of the flare is that we're not totally igniting the immune system. And so over time, it could learn, oh, this isn't as big a problem as we originally thought it was. And the antibodies will slowly diminish over time if the response is lower each time. So that's just been my experience in the PANDAS world specifically. Autism is very different. Again, there's a lot of overlap, but it was just very encouraging to see that most kids tolerated this very well, generally very safe. And from an effectiveness standpoint, yes, we see GI improvements, because even these kids with PANDAS have GI symptoms. So we see that, and those tended to be very durable. But the severity and frequency of the flares went down quite significantly, with several cases of kids who no longer had flares during the course of the time that we were monitoring them. So all in, I think very encouraging. A lot of times these parents, of course, would be doing other therapies, including IVIG and other natural alternative things to try to modulate the immune response and reaction. But FMT was like a driving force behind all of this. And I think very encouraging, and I would love to see, of course, more research, because this is becoming more and more common. It's unfortunately just more and more kids, of course, are being diagnosed with autism, with IBD, and as well PANDAS. And I know we're going to be going to a conference later this month. Maybe you want to talk a little bit about that. But yeah, just really encouraging to see where things are moving.
Yeah. And I think we've talked about this before, but like, disease is changing. I think the rate at which we're seeing some of these pediatric diseases, but also adult diseases, are getting diagnosed younger. And I think there's a lot going on. And everyone knows it's not the same world that we grew up in, and it's not the same world our grandparents grew up in. Things have changed. Food has changed. The environment has changed. All of these things play a role. But I think across the board, especially in conditions that have a tie back to the brain, I think it's key is like, FMT is not meant to be a cure for either autism or PANDAS. But the idea here is it's going to help mediate some of the issues through reducing gut inflammation, reducing immune activation, helping the gut lining to form or to build, as well as helping with that gut immune brain connection, all kind of coming together. And so I think that's the key here is that, well, these systems aren't working correctly. And we know that I was like, it's like a hard reset to start again. And so we're going to be attending the MAPS conference, which is a pediatric focused conference. And I am absolutely pumped because I want to have these interesting conversations. I want to talk to the people who are sitting in the room, looking at the parents and talking to these kids. How are we currently approaching it? Where are there holes? Where do we need to ask better questions? As well as trying to provide information in terms of where are we going and what kind of questions can doctors be asking their patients to better understand what other underlying things other than, I think when we focus on these diseases, we really talk about the behavioral aspect of them. But if you really get into a good conversation with a parent who is dealing with these things with their kids, the impacts of constipation or food aversions or sleep issues, all of these things are really driving a lot of the day-to-day struggle on top of it. So that focus on, if you want to know something about a disease, if you want to know talk to a parent because they track everything, they're really understanding, they know the patterns of these things. So I think the more we understand those, the better we can better ask the questions, better measure these things. When we were writing off our data, we approached it. These are the validated measures that allow us to get insights into improvements. But part of those came from talking to the parents. What are the concerns? Where do you think things are tied? And then you start going, okay, so how do we measure that? And that's across the board in pediatric settings is the way that the questions are asked. And a lot of these are the scales where you find quality of measures. One of them is always about the parent because the parent is a good measure for how things are going. And so we're excited to be in a room to talk with people to really understand. And the more we understand it, the more we can come and talk to you and explain it from a new standpoint. I think the thing to close out here for me is from a safety standpoint, informed consent is always key. Really understanding the role the gut's playing in these things, but as well, I think age plays a role. I think using an adult or a formed gut microbiome in someone that's still so flexible, I think age is a key thing. And I think we 3 to 5 windows when we're hitting that adult-like. Before that, everything is so flexible and changing and fluid that from what I understand, and you might have more to add here, but we want to get to that window where we know that the gut looks like an adult. So putting in the instructions from a completed gut isn't going to cause any huge, I think, shifts that don't make sense. And I think that's part of why when you're looking at this research in pediatrics, they're always starting on the upper end. That 3 to 5 tends to be the youngest. And I think I don't think we'll see before that in any research.
Well, in many cases as well, it takes until they're approximately 3 to even get a formal diagnosis. So in any event, yeah, the full presentation of the syndrome or disease or whatever we're wanting to call it takes a little bit to fully present itself.
Yeah. And having had a 3-year-old now, pre-3, it's all a guess, really, isn't it? And I think parents know and can see these things, but I think from a clinical standpoint, like you want to wait until you can at least diagnose, but as well, I think from a research standpoint, we're always going to use that kind of understanding of when the gut is shifting to kind of being more complete and having a similar types of populations and composition and diversity is really key. But I think that's part of this conversation across all of it is really understanding when and how. And we're getting both of those things. We're learning that as we gain more information. And I think this is an area to keep an eye on because I think it's going to continue to grow, especially because of the safety profile that we're seeing in those early studies. They really do kind of lend to being able to ask more questions and do larger scale trials.
Exciting. Well, it was another banger. I hope you guys all enjoyed it. If you haven't already, like, subscribe. It really helps the YouTube algorithms. If you're a physician, we'd love to connect with you. We're happy to share all of our protocols, our write-ups. That's a key part of what we do here is educate and share everything we're learning in bite-sized, easy to digest, easy to use protocols. So without further ado, we'll see you on the next one.